Word. Excellent. So we are now live and recording for posterity. And I'm going to just keep an eye on anyone else who will be jumping in over the next few minutes. And since it is a little after 12 o'clock, I'm also going to take this opportunity, besides watching the admit cues, to say good afternoon, at least if you are on Central Time or Eastern Time. If you are joining us from earlier time zones, good morning. My name is Seth Stander, and I have the pleasure of serving as the community aging specialist for HHCI Cares, that part of Healing Center and Institute that focuses in on caregiving, aging, resilience, ethics, and spirituality, hence the acronym. We decided it would be a lovely idea to go ahead and to make that a verb in addition to a description of what we do here at the Hope and Healing Center and Institute. Dr. Peggy Dettermeyer, who is on as well this afternoon, directs HHCI Cares. And together, we are thrilled to have you joining us for our October Lunch and Learn, which features Morgan Zeringue, who is the manager of coaching and case management for Alexander Jewish Family Service here in Houston. She, in a few moments, is going to go ahead and take us through how JFS engages seniors through supportive services. Having said that, I want to make sure to go ahead and give a proper introduction, and by way background, describe where Morgan has been in order to get to where she is today. So Morgan graduated from the University of Houston in 2011 with an MSW and with a passion for program implementation. In 2015, she began working in the Employment Services Department of the Joan and Stanford Alexander Jewish Family Service, focusing on program implementation, studying service gaps, and increasing service delivery. After a series of floods, hurricanes, and other local emergencies that folks here in Houston and the region know of very well, Morgan created a premier disaster services team, finding ways to maximize staff productivity, to centralize client processes, and promote professional delivery of service with a layer of compassion. Morgan presents throughout our area on best practices in building case management teams. She serves on the executive committees for our local Voluntary Organizations Active in Disaster, or VOAD, and the Harris County Long-Term Recovery Committee, which has no real pronounceable shorthand. It's simply known as the HCLTRC, or I would imagine the Long-Term Recovery Committee for short. It is a pleasure, Morgan, to have you educating us this afternoon, and I am going to mute myself, watch the chat, and hand over the floor to you.
Awesome. Thank you so much. Thank you for having me. And I am excited to share with you guys a little two parts to make sure I am up. There we go. You guys can see my screen okay? All right, so I'm going to share in two parts. I'm going to talk a little bit about just JFS, Alexander Jewish Family Service, and the services that we offer and provide, and then move into some context around how we provide services specifically to seniors and some of the best practices that we have developed over time that work for us and we found really help to empower and engage the senior population that we work with. So Alexander Jewish Family Service is a multifaceted human service agency here in the Houston area, where we provide light, hope, and help to the community through a variety of services. These are just some fun facts about us. So we actually were started in 1913, so we're 110 years old. And we are also one of the founding partners of the United Way of Greater Houston, which is really awesome. And here just talks about what our mission is. So our mission here is to really transform lives by empowering individuals, families, and communities. We're driven by compassion, lead through innovation, and guided by Jewish values. Here is just a snapshot of the different services that we offer, and I'm going to go through briefly each of them just to kind of talk about what type of supportive services are involved in each of these areas. And so the first service offering is our behavioral and mental health services. We provide so many wonderful things through behavioral and mental health services, from individual counseling. We do group counseling, marriage counseling. We start at age 2 for counseling services, and we go all the way up. I think our oldest client is 100. And so we really provide a full range of services when it comes to behavioral and mental health services. We also offer a variety of really great support groups. We have support groups for older adults. We have a caregiver support group. We have support groups for teens with developmental disabilities. We have support groups for younger children. We have play therapy. We offer music therapy, just really a variety of individualized therapeutic services. In addition to that, we have a variety of community intervention programs. And so we do a lot of suicide prevention work. We are one of the leading providers of mental health first aid training, which is a very cool training that teaches individuals, communities. We even go out to several schools in HISD and teach middle school and high school students how to recognize the signs and symptoms when someone's having a mental health emergency and know what the resources are that are available to them if they are having a mental health crisis. And so often we like to frame this in the context that while for much of our history, many of us have been trained in CPR, right? And know what to do if someone is having a physical health emergency. Many of us have to have a CPR certification and have to have that updated. But not as many people are comfortable or feel confident in what to do if someone is having a mental health crisis. And so we work really hard to normalize and remove some of the stigma behind mental health, and just help people, adults, youth, children, know what to do if their friends, their community members, their neighbors, someone that they're caring for is displaying signs and symptoms that maybe they need a little bit more help and a little bit more attention outside of what you can provide. So we do a lot of community intervention around that work. Coaching and case management is the department that I oversee. So we provide a wide range of services. I'm going to talk today specifically around senior adult case management. But in addition to senior adults, we also have family and children case management services. We have disability case management services. We have emergency case management services, as well as a specialized programs for Holocaust survivors, which I'll talk a little bit about later. In addition to case management services, we also offer financial coaching and financial stability classes and one-on-one coaching. So we do a variety of things in collaboration with the Women's Resource Center of Houston, where we offer and work one-on-one with clients to understand their financial situation, help them make changes in their financial situation, and really coach them through feeling more confident about their income and their budget, and knowing what resources are out there to support them. In terms of case management, we do a variety of things. We provide some basic needs assistance through the United Way 211 helpline, where we assist people in the Southwest Houston region with things like rental assistance, mortgage, utility, and food insecurity. We have a small food pantry here in-house where we're able to provide immediate food for walk-ins or for people who may have immediate needs or may have a lack of access to local food pantries. And then we do general things like helping people apply for public benefits, helping people apply for Social Security disability, navigating their benefits. Oftentimes, the language that letters and follow-up information that is sent out to clients can be really hard to understand or very overwhelming. So sometimes it's just walking them through what those letters mean and what their rights and responsibilities are, helping them recertify for benefits, and just really helping them navigate the different systems that many of our clients really depend on in order to thrive. The next service that we offer is disability services. This is in two parts. We have a transitional workshop program here on site and also in West Houston, where we offer supportive employment services to adults with disabilities. So we have a really great disability service program. It's called Celebration Company, where they do a variety of things from rolling candles to creating artwork and really highlight the work that they are able to do. They are all paid minimum wage or higher, and it really is a great place for them to come for support for the families, but also for them to be able to work and socialize with each other. In addition to Celebration Company, we have a really great film and arts festival that if you are local to the area, I encourage you look it up. And so it's called Real Abilities. Real Abilities is in partnership with the Mayor's Office for People with Disabilities. And in February every year, we do a variety of music, film, and art festivals that all highlight individuals with disabilities who have really made a mark for themselves in society through art, through music, and other wonderful arts collaborations. We have career and employment services. Our career employment services are two parts. So we have a contract with Texas Workforce Commission, where we support individuals with disabilities in finding and maintaining employment. And then we also have a career services department that has really flourished after post-COVID in helping people who are having a change in career or looking to update their resume or gaining some new work skills. Maybe they have been out of the employment side for a while and feel like they need to brush up some of their skills. We have some great partner collaborations like Dress for Success and career gear that help people access interview clothing, suits, and other items that they may need to be successful in employment, and really just provide a really great variety of skills here. We have a computer lab that's open to clients that can be used for job search. It can be used for benefit application as a place to come in and disconnect from somewhere like a public library that tends to be busy. And so it really is an individualized approach to getting some support in your job or career search. And then the last service that we offer that is direct client service is our chaplaincy program. So we work with about 10 different hospitals in the Houston area where we provide chaplaincy, prayer, Shabbat boxes, which is a very cool program that we have, and just a variety of supportive services to patients who are sick, who are in the hospital, and may need some additional chaplaincy support as they're navigating that next phase. So I'll talk a little bit now about our client service model and the things that we really feel like are important and have really helped us to make meaningful relationships with our clients. And so we really see the process with clients as being a holistic, client-centered process. So we work very hard to ensure that our client is at the center of everything that we do, that we are keeping them in mind when we are creating plans, case management plans, care management plans, treatment plans, and that really we are including them in each conversation and ensuring that they feel like a partner in this process and not that we are directing them in which way they need to go. And so with my team, I often say, think of the word case manager. Oftentimes when we think of the word manager, we think that someone is going to direct us or guide us or tell us what to do. It's really important in order to have a great understanding with your client that they feel like that they can walk alongside you and that they can receive guidance and understanding and navigating those systems together. And so we really take pride in ensuring that clients are at the center of the work that we do. And also when it comes to the holistic model, we are very lucky to have a variety of programs on site. And so we really work hard as we are creating the treatment plan that if a client is in need of services other than case management, that we have an efficient way internally that we can connect them to those other services. So as many of you guys know from doing this work, someone may come in and identify that their immediate need is food. And as we do our assessment, we find that there's significant trauma and there's some other underlying things besides just the food that client could use support with. So of course, we'll do our initial assessment. We like to Band-Aid the immediate problem and providing them with the food that they need in order to feel that their immediate concern has been addressed. But really, we focus in as interdepartmentally to see if we can help connect them to therapy services, or if we can help them with some socialization, or maybe there's someone in the home that needs some support with career services. But we really try to take a very holistic approach to navigating what the client's needs are and really helping support them through that process. And so I say here, it's all about relationships. I can't stress this enough. I think in order to, again, have a positive relationship with a client, it really is important that they feel engaged and they feel involved in this work. So we have a pretty our intake process, we really require that the client reaches out to us directly. So while we're absolutely happy to support a family member, have a conversation with a community member or a family member about a case and provide suggestions and resources, in order for someone to become a client, we really want them to reach out to us and be interested in the services. And I think that this model comes from the idea that if someone is forced to do something, they may be a little less likely to engage at their full capacity or be excited about the potential of the relationship because it's something that was forced, right? Whereas if someone reaches out on their own and understands the benefits of the programs that are offered, understands the benefit of the relationship that they can potentially have with the case manager, we find that the process goes better and that clients are more engaged, they're more open to working directly with the case manager, and it feels more like a choice rather than a forced interaction. So we really work hard to support the client and surround the client, but we really want the client to be the one to reach out and be interested in engaging services. And of course, we support the families. We do this creatively sometimes. As you know, clients can be resistant to reaching out for help. They can be hesitant. They're not sure what that means for them. But, we really try to support the families and support each other. So sometimes it can start as a three-way phone call with the family on, where we're explaining what kind of things that we can offer. And we really try to embrace the situation as a sharing of resources, and really starting with how can our services benefit the individual, not what we're going to ask of you, what we're going to require that you do, but really just having a conversation with them about how can they benefit from these great services? What kind of things do we offer? What kind of gaps may we be able to fill with whatever it is that they're currently facing? And how can we kind of support them through this life cycle or challenge that they may be having at the moment? So it's all about relationships, guys. So one of the big core areas that we do here is benefit navigation. And so that comes in a variety of different programming, from government benefits, so things like SNAP, and housing benefits, Medicaid and Medicare. For those of you guys who don't already know this, the healthcare system is so complicated and very challenging to navigate on your own. And so often we get seniors who come in and they don't even know what's included in their healthcare coverage. A hot topic with a lot of our clients is medical transportation. And a lot of them are just not sure what their insurance provides, what's covered, how do they ask for those kinds of things. And unfortunately, as you guys know, the systems are overwhelmed and overloaded. And so it can take a lot of time to have to call into the Social Security Administration or go down in person. And so we do a lot of internal research. We have a lot of, we call them cheat sheets and guides to applying for Social Security, navigating Social Security disability, things to know when you're applying for any type of public benefits through Health and Human Services, and just really try to create some guides to help coach clients into being able to feel more confident when they're filling out these applications or when they're having an interview with a benefits navigator, but really supporting, coaching, and educating them to feel more confident about what benefits they're entitled to and how those benefits can impact their success and availability to other benefits. Another real core programming here in Houston is the CAP program. It's CEAP. This is run through Baker Ripley, and it's a utility assistance program that helps individuals, seniors and individuals with disabilities, cover utilities for a whole year. And so they navigate electricity, water, and gas. This can be critically important to individuals who are on a fixed income. So, and the challenging thing about the CAP program is that they do have to apply every year. So again, we do a lot of education with clients that it's time to reapply. And we do a lot of supporting them through the application process, as it is a bit intensive. But we just work really hard internally to be aware of what benefit programs are out there and really support clients both in applying, but also helping them gain the skills to feel confident in reapplying or interviewing, or just have those skills to really feel more confident in the future. Another really hot area in Houston is housing. So unfortunately, there is just Houston is huge for those of you guys who live here, and there is a huge lack of affordable senior housing. It does not exist in a lot of cases, and the wait lists are long. So, our individual housing co-ops that we have developed partnerships, most of them's wait list is about 1 to 2 years. The public Section 8 wait list here in the Houston area is about 8 to 10 years. for a senior, that can be detrimental when they hear something like that. So again, we work really closely with a lot of our public housing complexes to develop resource guides and information around when wait lists open for senior public housing, what their application process looks like, what kind of documentation do seniors need to bring in order to apply for that housing. But we really work hard to set them up for success and really ensure that they do not feel burdened by the systems that are around them, and they feel that they have a support person on their team to really help guide them in successfully applying for some of these communities. For those clients who can afford things like assisted living and independent living, which are great choices, that's about, I would say, less than 10% of the population that we serve. Because again, if you're in the Houston area, an assisted living center without any level of care starts at about $4,000 and can go all the way up to as much as $10,000 a month. And so for our clients that we serve, ideally, they are not able to afford those type of living situations, which makes it a little bit more challenging when we focus in on housing. There's two folds. We work hard to engage and encourage them to maintain their independence if they're able to live at home with some support like home care, which we'll talk more about. But for everyone, that's not realistic. And so it is a very big challenge that we have in working with seniors, specifically seniors who have medical challenges or disabilities. Really having affordable, accessible housing is really unheard of, honestly, in our area. And unfortunately, because of the population that is aging currently, it's just a big concern about the future of public housing for seniors specifically. So on the advocacy side, I also sit on the executive committee for our City of Houston Housing and Community Development Department, where I do a lot of advocating about what type of housing is being built, and really putting a highlight and a focus in on senior housing and affordability and access to housing for seniors. I talked a little bit about the chaplaincy program, but we provide supportive services to individuals who are in the hospital. And again, I think one unique challenge when I talk about, systems being overloaded and challenges with clients accessing resources internally and externally, I think one very unique factor when it comes to hospitalization is patient rights. And so I go back to education, but we spend a lot of time educating patients about what their rights are and families, what their rights are when they're in the hospital, requesting support from the hospital social worker, another overworked position. And unfortunately, what happens a lot of the times with our clients is that they do not know they have access to a social worker, and they have to request a meeting with the social worker who can do a variety of things for them. One is navigating their health insurance benefits and letting them know what they qualify for. It is required that a social worker, the medical team within a hospital, provides a discharge plan to the families before they discharge an individual. This is one of the most common calls that we get when it relates to senior services is my family member is being discharged from the hospital and I have no clue where they're going to go, what kind of support they have access to. And so those are first recommendation to people who are still in the hospital, inpatient, is that they ask to speak to the social worker and they really go through the discharge plan or the discharge summary with the social worker one-on-one. What often happens with the discharge plan is it is just lumped in the paperwork that they provide when they are discharging someone. If you've ever been in the hospital, you get a folder or you get a handful, a big stack of papers that tells you what's happened while you were there and what you ate and what your medications are going to be. And oftentimes that discharge plan is just put in with the rest of that paperwork, and families don't even know it's there or don't even know that they have access to that. So we really encourage families to work with the social worker to go through the discharge plan and get recommendations if the client is in need of rehab. What type of rehab is their insurance going to cover? Get some recommendations around rehab. For families, the planning piece is very important. So how long are they going to be in rehab? How long typically does Medicaid cover rehab? And so for most people, it's 14 days. And then sometimes, of course, if there is a significant need, it can be enhanced to 21 days. But that is a big deal for clients who are trying to kind of plan and coordinate what the next few weeks or months are going to look like for their loved one. So critically important. And we cannot stress enough the benefit of utilizing a hospital social worker when there's one available, and really having those conversations with them. The other thing that we have found helpful and successful is letting the hospital social worker know that you have a case manager. It's a great opportunity to partner with that social worker. It also shows the hospital staff that there are other people on the client, the individual, the patient's team who are invested in what's going to happen next, and who are supporting through that, and who kind of know about resources and navigating resources, and can just kind of put a pin in their ear and push things forward in a way that is positive and beneficial to the clients. Another really big hot topic, and as you guys, I'm sure, are experts, is caregiver support. And so this goes in a variety of ways for us. One, it is access to home care and understanding and knowing what type of home care is available and is out there. There is a small home care program here in Houston through the Area Agency on Aging that provides 20 to 25 hours a week for individuals for about 2 to 3 months as they are navigating a change in stability or mobility, or maybe as they're navigating access to home care through their health insurance or through other means. Typically, in our experience when working with Medicaid and there is a need for home care, most of the time, unless you can justify a higher need, Medicaid caps out at 25 hours of home care per week, which is great, but for some people it's not enough. So we really try to help them navigate. We help them work with their doctors to increase home care services if needed. And really kind of support them through their process. Another thing that's challenging about home care is the cost. Again, this is something I'm sure you guys are very familiar with. The average cost in Houston is about $26 an hour. And that is a big burden for families who cannot afford home care services. So this is, again, a place for us to educate families and individuals about resource navigation when it comes to care providers, and really set them up for success in understanding what type of transitional living might be helpful, and looking into, private caregivers or live-in caregivers, which are very hard to find in 2023, but really help them navigating the challenges of home care specifically. And then in addition to that, I talked a little bit about a Holocaust survivor program. So we do have a specialized program here in Houston for Holocaust survivors, where we are able to provide home care services to them through a couple of different funders. And so it's a really great program. We have in the Houston area, we have identified about 108 Holocaust survivors. And I believe we serve 102 of them through home care services, through the Claims Conference, and other supportive networks where we are able to help them age in the comfortability of their own home. For Holocaust survivors specifically, there is a lot of stigma. There is a lot of triggers around around facility care because of their experiences in the Holocaust. And so there's a lot of hesitancy in things like assisted living centers, nursing facilities, because of the concepts around the trauma that they had been through in their experiences. And so we work really closely with them. We work really super closely with their families to ensure that we are able to provide quality of life in their end stages of life. So we just had our oldest survivor turn 100 last month, which is amazing, and just feel so lucky to be able to provide support to them and their families as they are navigating these end stages of life. So that is a very special program that we have related to home care. One of the cool things that we do around seniors is holiday assistance programs. We often find that seniors who are living alone independently can often feel left out of important holidays, important traditional programs. And so we work really hard to make them feel special in these times of year that are meaningful and highlight. So we have Thanksgiving program, Rosh Hashanah, which is the Jewish New Year, Passover program. For all of these programs, we provide prepared meals and significant special items that bring the holiday to light for these seniors. And just really help them feel celebrated. We do handwritten cards to them and just provide significant items like candles or the Seder plate for the Passover that really makes them feel like they have a connection to the holiday. We're coming up on Christmas and Hanukkah season, and so we do a really fun program for the holidays where we have a Hanukkah and a holiday celebration party, and then we also provide treat bags for seniors that include things like fuzzy blankets and soft socks and a menorah or an ornament if they celebrate Christmas, and just really items that, again, it makes them feel included, it makes them feel remembered. And I can't tell you how many thoughtful notes that we get about how great it feels to not be forgotten. And so I think oftentimes we are so engaged in just the day-to-day work of benefit navigation, bringing them to doctor's appointments, etc., that we often forget how important and how significant the little things can be. And so we put a lot of emphasis on the little things and ensuring that they feel encouraged and supported on these very special days where many of us have families to celebrate with or other people in our communities to celebrate with. And oftentimes our most vulnerable seniors are isolated and in their homes alone. The other really kind of key service, which this will kind of be the end of the presentation, the last couple slides, talking about family mediation conversations. Mediation is a very legal term. So at JFS, we don't do anything legal. I'll preface it by saying that we refer them out for any type of legal services. But one of the most common things that we get around senior services is families who are really torn between what's next for my mother, my brother, my dad, what's the next steps? And what we often find is families have different ideas and different opinions about what's best for the individual. And sometimes it can cause a little conflict because, sister may think they need to go to assisted living facility. Brother may think they're fine and they can age in home with some different supports. But here at JFS, we really try to hone in around what is the client thinking? What is the client feeling is the best direction for them as an individual? And how can we kind of help them navigate through those things? So we really do try to remain client-centered. Of course, there are certain instances or indications where if there's a power of attorney in place or a guardianship in place where, yes, the family members or the siblings may have a little bit more authority in recommending or providing insight on what's best for the senior. But we really try to remind the families what a challenging time this is for the individual. Changes, aging, changes in life experiences can be a very overwhelming traumatic experience. Loss of independence is something we hear so much about from our seniors. So we oftentimes, talk with the families about taking a step back and really thinking about how the client is feeling, how that loss of independence might feel to them, and really navigate through, if there's not an immediate safety reason, navigate through putting the client back in the driver's seat and really allowing them to share what they feel is best and how they want to be invested in this process of change. Really encouraging the client to navigate which direction they want to go in, whether it's independent living with some supportive services or assisted living or having a family member move in. We like to remind the families that the client is really the driver of this process. And again, as I mentioned earlier in my presentation, we find that the more support and engagement that you give to the client, the more encouraged they are and the more open they are to following recommendations if they feel like they get to be the driver. They get to be in the driver's seat of this conversation. And so we find that that's just really important, is reminding families to think about how the individual feels and kind of help them navigate through that. Once we get through that initial consultation and mediation with the family, again, it's just kind of walking through what the future looks like for that client and really helping to support them through making the recommended changes. Internally, we do safety assessments. And so a safety assessment is where we go out to the home of the individual, and we actually do a physical safety assessment where we walk through the home, and we can make recommendations to the family and to the client about little things that they may be able to do and navigate to make the home feel safer for the individual, but also make the family feel more confident in the person being there. So we'll make recommendations of things like grab bars, moving rugs and cords that could be a tripping hazard, especially if there's a change in mobility for the senior. So let's say they had a fall and they're coming home with a walker. So we'll go in and do a safety assessment, and we may help them move some things around and navigate what are the safe spaces that the client can get through with the walker, what type of challenges in the house, maybe a mobility issue, help them to find resources to install grab bars in the shower, toilet seats, things that can just make that transition back home easier for the individual and the client. And then also, we work for clients who are renting. So they're in a rental property or a rental unit, apartment type facility. We will work very closely with the landlord because oftentimes they are mandated to make the unit ADA compliant. So we'll work very closely with the landlord and the maintenance companies to have those grab bars installed if that's what's needed, or to have, just little different accessibility things happen for the individual if that is something that they really need. So again, back to that, educating them on their rights and supporting the family and understanding what their rights and what kind of resources are available to them. So, kind of in closing and to wrap up, I can't stress enough how important it is to allow the client to be the driver of their journey. And we cannot assume that because of someone's age, or change in their lifestyle or change in their mobility, that they're not able to make decisions and be supported through some of those processes. And so we work very hard here at Alexander JFS to support the client through that transition, acknowledge the feelings that happen behind the loss of independence or changes in the lifestyle, loss of spouse, loss of family members, and really supporting them through the trauma side so that way we can be successful in relationship building and helping to navigate solutions to make them feel whole, but include them and really make them feel like they are leading and guiding us in what is right for them through our recommendations and our support. So this is my contact information I'm sharing with you guys. If you have questions or are interested in services for someone that you know, we would be happy to support you. I am proud to say that and I can put in the chat our main line, but we have a case manager of the day system where every single day of the week, we have a case manager on call who can assess client needs, whether they walk into the building for services or they call our main line for services. We always have a live person who can talk to them and support them through whatever it is they're facing, regardless of whether they're in our region and we have direct services to help them. We really take pride in being one of the few social service nonprofit agencies that provide emergency assistance and answering every call. So we answer every call. We call every person back, regardless of whether we can help them or not, because there is a level of healing and compassion and just being a listener and being able to support clients through whatever they are going through, regardless of whether we have resources to help or not. So thank you guys so much for having me today. And if you have questions, I would be happy to answer them. And I just appreciate you guys and the work that you do.
Thank you for a really impressive and thorough presentation, Morgan. And I am proud to know you and your department, and grateful that you continue to work diligently, either in terms of direct service or in terms of service referral, which very often one of the things that, of course, can get lost in all of this is a sense by the client or those who hold them dear that there is something to hang on to in terms of hope and the ability to say, we're gonna walk you through this particular set of circumstances. You are not going to be alone. This is information which ultimately we need to hear when we're in crisis or anticipating changes in condition. I will remind everybody that a copy of today's recording and slide deck will be made available to you soon after the completion of our program. Morgan, if you don't mind going ahead and putting your information again in the chat, we've had a request for that information one more time. That would be terrific. I certainly want to open the floor in the time that we have remaining for any type of questions or comments from those in attendance. For those of you who are watching and learning from this at a later time, please feel free to go ahead and to reach out either directly to Morgan through Alexander JFS, which is the website is the name alexanderjfs.org. Or you can certainly go ahead and go through us at hhci.org for the Hope and Healing Center and Institute. And we will certainly make sure to make a referral as needed, especially if there is a specific type of service that geographically Alexander JFS can provide for you. Otherwise, we will certainly work with our case management team to make sure that you are pointed in the right direction, as well as helping to navigate the alphabet soup of agencies we never knew we paid for as taxpayers until the need comes to life, such as the Area Agency on Aging, the Aging and Disability Resource Center, the Long-Term Care Ombudsman Program, and so much more. I do have one question which I would love for those who are not experts in this. You made it a point to emphasize the types of benefits that may be available through Medicare for, say, prescribed inpatient or outpatient. We'll use the example of physical or occupational rehabilitation after a hospitalization. Can you talk a little bit more about are eligible in terms of community-based service?
Yeah, I'll say a couple of things related to that. One, it depends on the type of plan that the individual has. And so that piece can be very overwhelming to clients because they don't always, some people will come in and say, well, I know I have Medicare Part B, but I don't know what that covers. And so we work yearly to get educated by some health insurance specialists who really walk our case managers through what each plan covers and how those benefits can be accessed by clients. I'll say for both Medicaid and Medicare, a lot of it has to do with how the doctor or hospital staff codes the injury or codes what has happened with the patient. So again, it goes back to just educating the family and the patient on their rights, and sometimes stepping in and talking with the social worker to help them understand the unique needs of the family and how to, they often say they have to write it in for insurance in order for it to be approved. So it really just goes back to the education piece and the advocacy piece, because if not, what oftentimes happens is if Mary's daughter is there there at the hospital staff just assumes, well, I'm going to just discharge the patient home to Mary and everything's going to be all good. Well, what if Mary lives in a third floor apartment that the parent can't get up and down the stairs in order to navigate that? So we will often tell families that they can refuse is a strong word, but explain to the social worker that the patient cannot be discharged until a discharge plan is in place, that they do not have a safe space to be discharged to. And that oftentimes will kind of get the social workers working and get them to be more creative about how they are writing into insurance what the needs of the patients are, so things can be approved more promptly and quickly for the patient. So much of it is just around education and knowing what the patient rights and responsibilities are.
And I think you're raising an excellent point, because very often we are not electing to enter a hospital. There are occasions in which we have planned for a hospital stay, a procedure, and for our discharge planning, all wrapped up into a wonderful bundle. And when that occurs, it's terrific, and certainly it's informative as far as as how to navigate the system before you're in crisis. But when you enter in crisis, and inevitably discharge planning, as we know, begins upon arrival at the hospital, perhaps even before you are taken off of, say, observation or emergency room status and formally admitted to the hospital. That's when especially discharge planning kicks into high gear, that you have the right to say, you have not provided a safe discharge plan.
Yeah.
I am therefore not going to sign off on this plan as the patient, or depending on the circumstances, the patient's legally authorized representative,
Yeah.
in order to ensure that the hospital take the necessary steps to make sure that there is the type of care planning that needs to occur on a face-to-face level very often. And as you said, coding is key. If it's prescribed, it can be covered.
Yeah. And I think the other unique thing, I didn't talk a lot about this, but something that we do a little differently is helping the clients and the patients understand APS. And so in a historically perspective, APS has always been seen in a very negative light, and that, we're going to have to call APS on you if this happens. We try to, again, in that partnership and education, help them to understand the benefits sometimes of involving APS. What kind of services might APS be able to provide if we do involve them, versus having to make an APS claim behind their back, and then they think you have, you've broken their trust because you reached out to someone about my case. We really try to talk with them and to say, like, hey, here's some of the things that APS might be able to provide as supportive services if we reach out to them. If your home is not suitable for, care, they may be able to go in, and we've had APS pay for clients who have had excessive contents issues to go and clean out their home after a hospital stay, and provide additional support through home care for the first week. So that's the part that I didn't talk a lot about, but I think there's a lot of stigma around APS. And I think that in education and understanding how to navigate some of this, you can help clients see the benefit in some of those services as well.
And I think you've raised again another important point. When one engages the services of APS, you are not doing it as a punitive action. You are doing it with an eye towards corrective action, especially if the primary concern is self-neglect of someone who you love. Situation where they are unwilling or unable for whatever reason to go ahead and to live in and one can live in a cluttered environment and be safe until they're not. And then the question become a fall risk, and you are living in an environment that is not conducive to your continued health and well-being. What can be done to go ahead and to create a safer environment, aging in place as you do so, versus the idea that somehow your autonomy and your dignity are going to be set aside because you have not kept your home the way conventional homes are kept. There is a lot of stigma, a lot of judgment that tends to be projected upon social services of all types, but especially APS. So I appreciate you pointing that out.
Yeah.
There is a question in the chat about how would I begin to navigate in Maryland? And what I would say is every county, every territory in the United States has their version of area agencies on aging, aging and disability resource centers, and when appropriate, long-term care ombudsman programs. So I would begin with the websites for your county in which you reside. And you can certainly go ahead and just do a basic search. They may refer to themselves by other names. For example, the Aging and Disability Resource Center here in Harris County, which Houston encompasses the bulk of, is known as Care Connection Aging and Disability Resource Center. So you don't necessarily have to just do a Google search, but it is actually a pretty straightforward process to find that agency when you go ahead and look for county government. And then from there, you're in good shape. If for some reason you're having any difficulty with that, remember that you can also contact your local elected representatives, whether they are municipal, county, state, or federal, and they will go ahead and provide you with that information as well.
And the other thing I'll mention, just because this question is specific to a home fire, is that in the beginning they mentioned that I am a partner of the VOAD. So VOAD is a national thing. And so there's actually a Maryland VOAD. It's I just put it in the chat. You can look on there at the list of partners, and those partners are specifically disaster and emergency response agencies. So that might be another great avenue to reach out to some of those agencies and see what services they offer directly related to the home fire as well.
Very much appreciated, and thank you for going ahead and making that particular VOAD site available right away.
And the cool thing is every single state has a VOAD. There's a national VOAD. So you can just Google your state, and it gives you a good idea of who responds to these type of things in your area.
It is hard to believe that we have already been here for an hour, but it has been jam-packed with some terrific material, not only specific to what Alexander JFS can offer directly or by way of referral, but also I hope it has served as a good way to remind all of you that you do not have to navigate illness, injury, and more emergency circumstances, disasters alone. We are a patchwork quilt, if you will, of services, but that patchwork quilt is pretty strong. And we encourage you, if you're having any difficulty emotionally, logistically, in engaging in accessing those services, to turn to organizations like Alexander JFS, to turn to case management services through places like the Hope and Healing Center and Institute, through the United Way and 211, and to make sure that you get started on the process with allies. And with that, I will go ahead and say thank you for spending the hour with us. Morgan, thank you so much for your time and your expertise. And again, for everyone out there, copies of the recording and the slides will be coming your way soon. I hope that everyone has as kind and as gentle a remainder of the week and as relaxing a weekend as possible. And take care.
Thank you all so much. Take care.